All right. Welcome back to Type 1 Thursday with me, Hannah. I am happy to see you here again today, and I can't wait to discuss today's very important, but maybe my shortest Type 1 Thursday ever. But yeah, I can't wait to discuss this topic with you because the topic today is medication. And although this is a super important thing when managing your diabetes, I am unfortunately not a medical professional, ergo, I am not allowed to give you any advice on this. This is why this might be my shortest Type 1 Thursday ever. But, we'll roll with it, and I'll give you some general tips and tricks of what you can do and what you should look out for when it comes to medications and your diabetes management. Whether this is type 1 or type 2, doesn't really matter. Most of us need to, unfortunately, be on medication anyway. Type 1s, of course, forever and ever until the day we die, we need to be on insulin at least, if not other medications. And type 2s can get away with not being medicated. But in case you are, then this could be something for you as well. Who knows? Anyway, the first thing to really make sure that you have is a great cooperation with your healthcare professional, because they, in comparison to me, can give you advice on medicine and medical issues in your management. I can only give you rules of thumbs and things that I've done and that have worked for me, myself, and that I know from other people's experience. Nothing else. Glad we got that covered. So basically, with your healthcare professional, you need to find out whether or not your medications are actually what you need. And so many cases that I know of are actually given not entirely the correct medication, they find out in hindsight. So this is where, you really have to speak up as a patient and tell your healthcare provider, whether that's an endocrinologist or CDE or nurse practitioner or whatever you prefer to go to. You have to have an open conversation with them in terms of how you feel, how it's affecting you, how it's affecting your lifestyle, your energy, and what your blood sugar numbers, for sure, if you do live with diabetes. This check can both relate to the amount of a medicine that you're already taking or a type of medication that you're taking. So do have someone that you can really trust on your team so that you can get the help that you need in terms of medication. This medication, as I touched upon a little bit before, needs to fit into your lifestyle as well. So if it doesn't fit you to feel sluggish and not energetic and slow and just generally crappy, then definitely speak up, do something about it. There's always something that you can do to feel better, as I usually say. And there's always, or most often, there is another medication that you can try instead to make sure that you get what is right for you, for your lifestyle, for your body type, for everything that can have an influence there. So let's go more into insulin. Are you actually, or have you been given the correct types of insulin? There are many types of insulin, different lengths of well, how effective they are and how long they last in the body. And that's also individual, how long they last in your body. For me, for example, my short-acting insulin that I'm on all the time, that lasts quite short in my body. It's only 2 hours. So, it's not really, and that can last a lot longer in someone else's body, 4 or 5 hours, and so that's something that you have to find out first of all. And second of all, are you taking do you have the right type of long-acting insulin, for example, for your life, for your diabetes, for the way that you want to feel? There are many different types of long-acting insulin. They have different aspects and attributions to them. So check out if you maybe need to change yours or try another one for a while. in most cases, you can try a new one and then go back to your normal routine if it doesn't work out for you. And I think as patients, I think that's very important that we have that choice. Also, we have different types of short-acting insulins, rapid-acting ones, and also we have, for example, regular insulin, which covers, for example, protein very well, and can be a great tool to have if you are willing to try it. It doesn't act like the other insulins, so don't expect that, but it can be very helpful in certain cases, especially with perhaps a more protein-rich way of eating. When was the last time you did some basal testing? And I'm going to do another video completely on this in a couple of weeks' time, but when was the last time you did a proper basal test to check if your basal insulin, whether that comes from a pump or long-acting insulin, is actually accurately dosed for you and your life and your diabetes? For example, someone may be more insulin sensitive at times of the day, or more insulin, what's it called? Insulin resistant, it's called, at other points of the day. So we have to make sure that the basal insulin is correctly in a correct amount for you. And this is best done through fasting, and you check your blood sugar every hour, sort of thing, throughout a 24-hour time period. This can be split up in different days. Anyway, I'll get to that in a couple of weeks' time. Basal testing, very important to figure out if you're doing the right thing with your insulin. Another thing is pre-bolusing. Do you need to pre-bolus for your meals? Maybe check that out. You can, if you feel comfortable with it, you can try around a little bit with that and see if you get better blood sugar results through that. Then we also have the maybe not so directly diabetes medications that you may or may not be prescribed. And this is also where you have to work through all of this. You have to work with your healthcare provider and see what can be maybe improved, maybe added, maybe taken away, maybe, yeah. So the non-ones are sort of the blood pressure medicines. Being diabetic, one of the sort of very milder complications can be high blood pressure. Maybe you are on blood pressure medication, maybe you need to be on one, and maybe you need to be on an ACE inhibitor, which has been shown to sometimes protect the kidneys from damage, for example. Is a statin really necessary in your specific case? Discuss with your doctor. Bring papers, bring backup, bring your research along, and they usually try to accommodate, or should try to accommodate you. Doesn't mean that everyone does it, but you should. Also things like metformin, maybe that could be beneficial, or maybe you don't need it anymore. You have to have an open dialogue with your healthcare provider, and that's sort of my main point when it comes to medications. I can give you ideas of things to think of and bring forward to your doctor, but I cannot give you advice on exactly how to do it. And if you have any ideas, or for example, are you on some kind of medication that you are unsure of, or maybe that you need or don't need, or you're not sure about, how about you talk to your doctor and let us know how it goes. Can't wait to see you next time.